whatever symptoms we think that an adult can have, the child can have everything, like juvenile diabetes, alopecia, rheumatoid arthritis, so many muscular diseases. Then in teenage we see migraine so common. Teenage anxiety, depression has become nowadays very, very, very common. I mean, I can say once or twice a week there are new cases who are teenage anxiety, teenage depression with very bad suicidal tendencies. So common. I think the exposure to the social medias, and then there is so much of they say FOMO, and they want to be there, and then actual world they are so alone, but then they're just trying to prove that. All nowadays in teenagers become very common. So for all this, homeopathy is very, very useful. If a child has fever for more than 2 days, the parents immediately say blood test kara le, investigate kara le, where it is any viral fever will stay for 5 days and the kid will be normal from the 6th day. I tell to all my parents. So there is something known as baby eczema or baby acne. The baby skin is so sensitive and it is so raw that it is going to react to whatever you're going to apply. Now all kids are different, children's skin is very different. So when you start applying, like after born, like from 7th day or 15th day, either you are doing the massage of the baby or you have a malish wali who does. So
Right.
what kind of oil you apply, and you always moisturize the skin also. So whatever you apply on the skin, the child might react and the entire body will be full of boils. Now those are just reactory kind of skin inflammations and not eczemas. So there are exercises which releases the colic, and the child might pass stools or a lot of gases and he can get better. Or there are many SOS colic medicines. Why I usually have a homeopathic emergency kit given to parents or taken by the parents, which has a medicine of colic, and you can give the medicines to them. So like in the
Welcome all to another episode of Homeomitra Vartalap, and today's Vartalap is going to be about children. And in that, we are going to talk about a specific and a very specialized subject, which is homeopathic pediatrics. So, who else to talk about such a specialized subject than the specialist herself, Dr. Aditi Salvi? Welcome, Dr. Aditi.
Yeah, thank you. So I'm Dr. Aditi Salvi, and I'm practicing homeopathic pediatrics since over 15 years. So I have done my undergraduation BHMS degree followed by MD Pediatrics, which is a specialized MD degree we have in homeopathy, and then I begin my practice, which is over 15 years of yeah.
Good. So, Dr. Aditi, tell us something about this specialized subject, because I am not sure how many of us would have heard about this particular thing, that in homeopathy, and that too in homeopathy pediatrics, means specializing in childcare.
So to begin with, like when I began my practice 15 years back also, there were mothers who preferred homeopathy for their children, but they used to prefer, there was not much awareness. So they used to come to me after trying allopathy and not getting better. But now over the years, the awareness has increased so much. And obviously the parents are Gen Z parents, so they are being actually Googling everything, and they are well read, and also they prefer going to a homeopath who is specialized in homeopathy. So they come to me because I am an MD pediatrics in homeopathy, and they go for themselves to other homeopaths who treat adults. So it is actually helpful in that way. Like over the years, I have seen a great progress in how the mothers and how the parents actually come to doctors. So it is, I think it is very good that if you can go to pediatrics, because we have a 3-year proper course in pediatrics. So we have dealt with seeing pediatric diseases, the way we manage pediatric cases in homeopathy. And why homeopathy? Because homeopathy is safe, it is gentle, it is effective. And in homeopathy, we don't only treat the disease, as everyone knows, we treat the individual in diseases. So so I always tell my patients in homeopathy, usually there are like two kinds of medicine. One is constitutional, that is immunity building medicine or a chronic medicine. One is acute medicine. So now when a child comes to me with repeated cold, cough, fever, at that time I will see the symptoms and I will give the acute medicines. And when the episode is tied off, we start with the immunity building medicine. So the frequency of attacks or frequency of symptom decreases, the intensity of symptom decreases, the trigger factors because of which they catch infection decreases, and overall the child gets better holistically.
Right. So, see, we have usually, whenever we heard, like, let's say even before I became a doctor, the meaning of pediatrician would be an allopathic pediatrician.
Yes, yes.
Correct. So now, how do we, or for common man, would they understand the difference between a homeopathic pediatrician and allopathic pediatrician?
So I think for allopathic pediatrician, usually when they say pediatrician, the term always comes to allopathy. But to be honest, over these years, I have patients from newborn, just born babies who have had whatever kind of illness or symptoms to the age of youth. See, allopathic pediatricians are necessary because there is scope and limitations of every system. So there, where you feel the homeopathy is not working, when the doctor is not available, or for vaccinations, because in homeopathy we don't believe in vaccinations, so the allopathic pediatrician comes in handy. You can go to your allopathic pediatrician and you can come to us for all other symptoms.
Correct.
Hmm.
So now, going further, if you could just share some of your, I would say, experiences where, or the range of diseases or illnesses, symptoms, where one can look forward to taking homeopathic
Yes.
medicines in children. So let's say we'll start with the age group first.
Yes. So I'll tell you now, there is the classical scientifically age group, which is classified as 0 to 3 months is newborn age, 3 to 12 months is infant age, then 1 to 3 years or 1 to 5 years is toddler age, we say. After 5 to 9 is basically the child age, we say, or 5 to 12 also at certain extent. After 12, it comes the teenage from 13 to 19, and there is youth or the young adult, we say, which goes from 20 to 14 or 39, I believe. So basically, you can come to me or you can go to any homeopathic pediatrician right from newborn age till you are a youth, or you can say a young adult. Common symptoms we see in newborns, there are multiple symptoms we see when a child is born. The child has feeding difficulties, they have frequent colics, they have gastro reflux disease, which has become so common now. Gastroesophageal reflux, we say GERD, where the child is just vomiting immediately after feeding, and the mothers and the parents have to be awake whole night. There are colics which is happening. There are frequent cold cough nowadays because of the dust pollution. And then if you have an elder kid at home or anyone catching, because there is no immunity in a newborn child, the immunity takes time to develop. It takes 5 to 7 years for the immunity to set. So till then, whatever trigger factors are there, we see the kids falling sick. So frequent cold cough, fever, constipation, diarrhea, newborn colics, reflux disease. And when the newborn goes into an infant stage, they have teething problems, which are like very common things. Then they have constipation. Then there is when the child goes after 1 year, they have all these common things like cold cough, fever, diarrhea. But then whatever you see in adult age, all symptoms or all kind of diseases can be seen in young age also. I have seen kids with eczemas, I've seen kids with psoriasis, which is also very common, atopic eczemas or xerotic eczema, what we see. I have seen kids with thyroid disorders as young as 2 and 3 years also. Then there are multiple diseases like what we say IBS, reflux. Nowadays there are so many abscess. Right now, only 2 days back, a young girl of 4 years came with such a big abscess near the knee on the left side, suddenly developed like a small folliculitis, and it must have begun, but the parents thought it will rupture on its own, and she came with such a big, very restrictive movement. So whatever symptoms we think that an adult can have, the child can have everything, like juvenile diabetes, alopecia, rheumatoid arthritis, so many muscular diseases. Then in teenage we see migraine, so common. Teenage anxiety, depression has become nowadays very, very, very common. I mean, I can say once or twice a week there are new cases who are teenage anxiety, teenage depression with very bad suicidal tendencies. So common. I think the exposure to the social medias, and then there is so much of they say FOMO, and they want to be there, and then actual world they are so alone, but then they're just trying to prove that. All nowadays in teenagers become very common. So for all this, homeopathy is very, very useful.
So meaning the entire spectrum, not just the physical symptoms, but also the psychological symptoms.
Yes.
Can, they can be covered under this kind of things.
Yes.
Okay. Commonly of late, like in the past years of your practice, what kind of change have you seen in the kind of symptoms or the diseases the children have been presenting?
Okay, so I think in the past, after the COVID specifically, or in this past 3 years, I think majority of the children are falling sick very often with frequent coughs. Cold and cough are always a part of child's symptomatology ever since. But I think post-COVID, because in the COVID time, when the kids were born in COVID and they were not exposed to outside, they were completely homebound. And then once they were exposed to outside world, they tend to fall sick very often. So recurrent cold coughs, allergic cold cough due to this pollution dust which is going on right now in Mumbai and Thane. So this cold cough has worsened a lot. And second, teenage mental health has gone for a toss completely. I don't know, maybe because it was COVID and you were homebound for long, exposure to screen and not allowed activities outside, that has gone very high. And yes, last very close to my heart is that behavioral disorders in kids have been increasing. I mean, ADHD, or you say, if you know of, like, behavioral disorders are many type of disorders. So there is this OD, CD, oppositional defiant disorder, conduct disorder, which in normal term we say anger issues, temper tantrums, and all this have become very high. Also because I feel the parents have become very there is a lot of parenting pressure on the parents, and then every parent wants to do the best for their kid, which is genuinely good, but then overdoing also, and then making them too much safeguard has led to a lot of behavioral disorders in children. I can say that almost 5 out of 10 children nowadays are absolutely like hyperactive, restless, not mannered well, and then they have anger issues, they hit, and all that is going on. So in those cases also, if things are beyond a boundary where the child is harming the other kid, or the child is completely out of hand, you can consider homeopathy to treat this kind of disorders. It is very, very useful.
Okay, now this was about the psychological aspects of the child's health. Anything in particular which has changed, or you have seen that, let's say fever used to present like this in the past? Because at least personally, I have seen that parents panic a lot often
Yes.
nowadays because of fever. So is that panic valid, or like, how would you
I
orient
think that panic is because in this last 5 years, we all have been through that COVID and that panic of not getting fever, cold, cough. So that is inbuilt in all of us. So if a child has fever for more than 2 days, the parents immediately say, blood test kara le, investigate kara le. Where it is any viral fever will stay for 5 days and the kid will be normal from the 6th day. I tell to all my parents. So I tell them you have to wait for 5 days. But yes, we observe the kid. The kid has to be well hydrated. He is not deteriorating. He might be dull, not very active. And also the frequency of fever will reduce over the hours. Like the first day, if the fever was very high and it was every 6 hours, second day it will go to 8 hours, third day maybe every 10-11 hours, then we know the child is improving. But the parents are very impatient. With the 1 and 2 days of fever, they want to either investigate or go to allopathy and give antiviral fever. I have so many kids who have already like come to me later stage for frequent fevers, given antiviral medicine so frequently, like once in every 3-4 months for like 2 years of age. So I feel that that panic in parents is more higher now post COVID. Previously, like 15 years back, when the parents used to come, they were very patient with me. I mean, they would literally wait till the 5th day and then ask me. So I always say we have a 5-day window period in which till 3 days, if I feel the child is not progressing as I wish to, they are always in touch with me every single day with the temperature recordings and everything, and as and when needed coming to the clinic. So like by 3 days, if I feel that the improvement is not that great, even after changing medicines, I investigate. But any viral fever will stay for 5 days, so we have to have patience. So along with homeopathy medicines, we give them a little soft liquid diet, we give tappet sponging, that all measures have to be taken. But I think parents do have become panicky. So it becomes a little challenging at that time to convince the patient.
A question that would complement this would be, then when should be parents worried when it comes to fever?
First of all, when a child comes to me with fever, I obviously examine them. So I know if there is a fever which is viral or bacterial, it is due to either rhinitis, tonsillitis, or it is due to lower respiratory infections. I know it will take 48 to 72 hours. So I think the parent has to be patient till at least 72 hours. But obviously with the rise of malaria, dengue, typhoid, and jaundice, they want to investigate immediately. But there are so many investigations which are missed when the blood is not taken during the peak of fever time, or when the fever is not there, and then the reports can show negative. So I always tell them you will have to wait for at least minimum 2 to 3 days, 72 hours you be under my care, and then if we feel, we can investigate.
What about pediatric emergencies? If you could just tell us something about the emergencies that happen in children for a common man, how to understand that or grasp that, and then what is the approach that the common person should have when it comes to approaching the doctor.
Okay, so there are multiple pediatric emergencies. Like if you say the newborn age or an infant age, your pain is an emergency. The baby will cry his heart out. Colic is kind of emergency. So emergency, not that you have to rush to the hospital, but it is like a panic situation to the parent, because you see your 4-month-old child crying like crazy. It could be colic, it could be your pain. They can't speak, they can't express, you don't know. So if your doctor is well versed, you are in touch with your doctor, and the doctor is your pediatrician is approachable, it is very effectively you can treat the symptoms like colic or ear pain. If they fall, there is an injury, there is bump, the parents get panicked. If they have like cuts and all, these are very common superficial things. But yes, deep things like very severe abdominal pain. Now in kids it is not very common, but in the child age 1 to 5 years I have seen few cases of severe abdominal pain. So when the abdominal pain is very severe, or it is not severe but frequently happening, not reciprocating to the remedies given, you have to investigate them, do a sonography, do a plain x-ray abdomen. Intussusception is one of the very common things happening in children in 1 to 5 or 1 to 7 years of age. So it sometimes presents with very severe pain depending upon the grade of intussusception. Sometimes it presents with only nagging pain, and the patient has very nagging pain and nausea in the morning. The mothers will relate to कि school नहीं जाना है, maybe the kid wants to feel the inner sickness, or maybe in the morning it's just the anxiety to go to school. So we give them medicines, but if they don't get better, you have to keep all these things also in mind. Intussusception is the intussusception of intestine, it is an surgical treatment, so you have to refer to the pediatric surgeon or the allopathic pediatrician. So that cannot be handled with homeopathy, because it is obviously the surgical condition. So conditions like this we see where you have to be, I think every homeopath or pediatric homeopath has to be open to referring cases or referring children to the specialist as and when needed.
I think it is quite similar to what the allopathy pediatrician would do, that if there is a certain thing which is beyond his domain, let's say when it comes to a surgical emergency, or when the patient has to be admitted into critical care, that is when they would also refer. So the similar principles apply in homeopathic pediatrics also.
Yes. 100%.
Also, the other thing I realized that every early morning pain for a child is not because of the child doesn't want to go to school. It could actually be an abdominal problem. And sometimes it can be an emergency where the child might have to be admitted to the hospital. So I think in that case it is always better that whenever a child has an abdominal pain, they should go to the doctor, and rather than just say that it's out of some sort of fear or anxiety of going to school.
I think they should come to us. We should give them the symptomatic treatment, wait and watch. But if they don't improve, even after you are giving them medicine or changing the medicine 2 or 3 times, that means obviously it has to be investigated. We cannot just wait and watch or just go with the fact that बच्चा है स्कूल जाने के पहले रोता ही है. No, because many times on examination also there are few things which gets masked and does not come up. So obviously yes, you have to get investigated.
So any easy and quick and easy to understand tips for parents when it comes to child healthcare at home?
There are different kinds of child health related things at different age groups. Like I feel that you all mothers and all parents, obviously they also want to treat them naturally and not give medicine, be it homeopathy or allopathy. So like when the first year of age, the infant and the newborn till 1 year of age, the colic is very common. So when they have colic, in modern medicine we have that colic aid. So parents are so very fast to give colic aid, but it is not good also. It has its own side effects as well. So I always tell all my kids parents that you have to undergo, there are many of you exercises I teach them. So there are exercises which releases the colic, and the child might pass stools or a lot of gases and he can get better. Or there are many SOS colic medicines why I usually have a homeopathic emergency kit given to parents or taken by the parents, which has a medicine of colic, and you can give the medicines to them. So like in the first year of age, actually colic, constipation is very common thing when especially with kids who are formula fed. So when there is constipation where the child doesn't pass stool for 7 days is also okay. It is evident, there has been science behind it, and there has been it's written in the literature that even if the child doesn't go for 7 days, it is okay. By the 8th day, he should pass stools. It is nothing pathological about it. So that also worry you. The parents have to know about it. Like colic hai, constipation hai, cold cough hai, initial, like if the child has cold, the child when sleeps at night is going to have nose block because there is inflammation. So at night there will be dryness of the mucous membrane and there will be nose block. So I give them home remedies like making ajwain potli with little garlic cloves and putting it keeping the potli near the nose, so that when they breathe that it opens up. Or you can give that nasal saline drops, but obviously no medicated drops on this. So that can help. With frequent coughs, I ask them to take half spoon of honey and put little 3-4 drops of adrak, not too many, and then just mix. And if they can lick it, take lot of steam. If the kid allows, you can, if the kid is small and doesn't allow steam, we ask them to put the geyser on, and then in the washroom just put the shower on, so its entire washroom is steamed, and the mother or the father can sit with the child, and then he takes the fume, which is exactly equal to taking steam. So all these home remedies are also important. Along with that home remedies, every homeopath or your homeopathic pediatrician, we give SOS medicines also, if we know these are the frequent complaints of the child, which you can give them at home.
I think this was quite useful. I mean, not just from like home remedy point of view, but even homeopathic medicine can be helpful in home healthcare as
Yes,
well.
yes.
Right. Now, there's another question on the tangent. Since you talked about eczema in one of the earlier topics that we discussed, what is seen nowadays is up to 1 year of age, children often come up with all sorts of eczemas all over the body. Is my observation correct?
Yes, yes.
So there are two things which I have seen pediatrician do. Either they will just apply moisturizer or they will give a steroid cream. Okay. Now my first question is that is it normal to have eczema up to 1 year of age?
Okay, so I'll answer that. So there is something known as baby eczema or baby acne. The baby skin is so sensitive and it is so raw that it is going to react to whatever you're going to apply. Now all kids are different. Children's skin is very different. So when you start applying, like after born, like from 7th day or 15th day, either you are doing the massage of the baby or you have a malish wali who does. So
Right.
what kind of oil you apply, and you always moisturize the skin also. So whatever you apply on the skin, the child might react and the entire body will be full of boils. Now those are just reactory kind of skin inflammations and not eczemas. But it might be termed by few of the physicians as eczemas, but they are not. So you have to stop the cream and stop the oil or cream, whatever you're applying, and then wait for 15 days. It takes a lot, like 7 to 15 days for that thing to go. And then you restart with something else which can also react. So it doesn't mean that the child is reactive to everything. Few parents just stop massaging the child's body, that he's just reacting to every oil. So there are different kinds of oils which has their own inner nature according to weather. Like few oils are hot in nature. Now if that oil is applied in a hot weather with the fans closed, so obviously the child's body is going to react. So I don't think that these all things are termed as eczemas. There are something known as baby acne also, which come on the face, which are also due to, because they are dribbling saliva, they are breastfeeding, mother is breastfeeding, the milk is getting accumulated here. When you clean, your skin is very sensitive, they react. So this always has to be treated very naturally. You don't need medicine. But yes, if it stays for more than 5 to 6 days, we do treat them with homeopathy medicines and it goes away. But eczemas, actual eczemas, atopic eczemas, which are common in children, does happen, and I have seen a substantial rise in this condition, in this eczema condition, in this last, I think, 7 to 8 years. Previously there were not so many kids who were coming with eczemas, but yes, in last 7 to 8 years there is substantial rise in actual eczemas, which are not related, which are not because of the products we use or because of the child, and that actually needs a holistic approach and a proper treatment for it to go away.
In the first year of life, 0 to 1?
Yes, 0 to 1 also, it is very common.
Okay.
Yes. Yeah, and it is common, but then you have to differentiate it with, it is actually atopic eczema or it is due to the reactory to the whatever the products the kid has used.
So one of the myths is that grapes, bananas, strawberries, they should not be eaten in children who have got on and off, like you said, running nose, allergies, cold, cough?
So I'll tell you, there are multiple food items and there are too many myths associated. First is banana and curd. They say that you don't give banana and curd when the child is having cold and cough, which is absolutely a myth. It does not have any property which can ignite or cause cold and cough in children. Only if your kid is allergic to bananas or curd. That means if they take banana or if they take curd and immediately has cold and cough, then you avoid it. But since my beginning of the practice in 15 years, I've been telling all my parents that you can give banana, you can give curd when the child is having cold and cough, because curd is a very natural probiotic which actually helps in healing the cold and cough also. And second, what you asked me, Dr. Kayur, was about the grapes and strawberries. So grapes and strawberries has been a very bad throat irritant ever since. I mean, since last 15 years, I have seen cases of throat infections in winters only because the child has had lot of grapes and lot of strawberries. The reason behind is the strawberries and the grapes are loaded with lot of pesticides. So if we don't clean them properly, one, and if they don't clean them properly, they become a gastric irritant. Second, they are so addictive for the kids that the kids eat a lot of it. Like they eat a full bowl of grapes or the entire dabba of strawberry. So anything out of proportion is going to cause some kind of trouble. So eating in moderation, and especially for grapes and strawberries, I always tell the parents that when the kid is not at home, you can first soak them in a hot water with a pinch of salt, so all the pesticides go away, and then within half an hour dry it, and then your kid can have, but in moderation. Otherwise, there is no direct relation that grapes has any property in it to cause cold and cough. No, it is just eating because of the pesticide.
The second myth is about milk and milk products. So there is a kind of, I don't know, postulation or some sort of interpretation that a child only needs milk till the mother is able to feed the child. Beyond that, the child does not require milk and milk products.
Okay, so that is again a very wide topic we can discuss regarding breastfeeding. If you're particularly asking me about breastfeeding, I think breastfeeding is one of the very good positive things which a mother can give to a child, not harming anyone who cannot take breastfeeding. Formula food feed is also equally important, but yes, the child has to be given milk till 1 year of age, breastfeed or the formula feed. First 6 months has to be exclusively milk, and then from 7th month to 1 year is when you wean off the milk. You increase the introduction of the solids gradually, so that by the age of 1 year, the solids and the nutrition from the natural food becomes more, and milk is just a little, what you say, you get the nutrition, a little nutrition from, like a little nutrition from the milk, but the more nutrition from the food. But it is not necessary to compulsory give milk. It is not that milk ke bina bachcha bada nahi ho sakta. There is a thing that all parents are like, मेरा बच्चा जरा भी दूध नहीं पीता, वो थोड़ा भी दूध नहीं पीता, दिन में दूध नहीं पीता या रात में दूध नहीं पीता. It is completely okay. Milk has a minimum quantity of calcium and protein. The maximum calcium you can give is other calcium rich food. Milk nowadays is loaded with, we read so many articles that it is loaded with so much of hormones, because the cows and buffaloes are injected with hormones to produce more milk and to produce more quantities of milk. So if you give more milk, you are just giving them more hormones. I mean, it is completely okay also if a child doesn't have milk. I mean, if a worried parent comes to me कि मेरा बच्चा जरा भी दूध नहीं पी रहा, I pacify them. It is good. There is no problem. But you give all natural food items also. Like the sesame seeds are very, till what we say, is very high in calcium. There is ragi. There are green leafy vegetables. There are so many other items you can give instead of milk. So you don't have to worry that your child has to have milk, or your child has to have so many times, like 5 glasses in a day or 3 glasses in a day. Nothing like that.
The third myth is about cold food and ice creams. If you have cold food, then only you will get cold cough, because, or you had cold food, you have had cold and cough. Is it true? So the virus will attack, or the bacteria will attack anyways, even if...
Exactly. So basically, cold and cough is because of the virus and the bacteria, but the temperature of the food can be an irritant to your throat or an irritant to your nasal mucosa. Like if you have ice creams, the temperature, because it is frozen, it can irritate the throat mucosa, and it can cause inflammation depending depending upon the body's tendencies. Like in a few kids have ice cream and they don't have anything else, but there are few kids who immediately catch because they have a tendency to catch. So here where homeopathy helps, that it is basically we try to help their tendencies, help their trigger factor, so that the trigger factor doesn't cause. But yeah, it is not like that only cold food causes. The cold food actually irritates the mucosa and that causes the infection. So those are just inflammations basically, but not viral and bacterial.
Okay. I think we have so far covered the all the topics. If there are more things that you want to know, please leave them in the comment. Any particular topic that you want Dr. Aditi to speak about, we will take that up. But for now, thank you, Dr. Aditi, for
Thank you
sharing
so
such informational things with us, especially about pediatrics, homeopathy, not just about the medical aspect, but also about some things that parents can take care at home also. So once again, thank you so much. Looking forward to more such podcasts with you.
Yeah, thank you,
Thank
Dr.
you.
KO, so much for inviting me and doing this podcast. Thank you so much.
Thank you.